We present the case of a 47-year-old woman with 12 years history of chronic idiopathic ulcerative colitis and without a good treatment, only with intermittent oral intake of prednisone and poor adherence to this. She also referred that 5 years ago she presented an ulcer on her right leg and was cured with oral prednisone. The chief complaint was for abdominal pain and bloody mucous diarrhea of 1 week of evolution. For this reason, a rectosigmoidoscopy was performed and the diagnosis of moderate proctosigmoiditis was made. For this, topical and oral mesalazine was started, but the patient was reevaluated 1 month later for persistence of symptoms and for presence of painful ulcers on the pretibial area of the right leg. They had a clean bottom, well-defined and purplish edges, and had begun days before like pustules. For this, a biopsy was taken and the diagnosis of pyoderma gangrenosum was made, like an extraintestinal manifestation of ulcerative colitis. For this extraintestinal manifestation and for the persistence of intestinal symptoms, we added high doses of oral prednisone to the treatment and azathioprine, like a steroid-sparing agent, due to the poor response to mesalazine and to reduce the toxicity effects of steroids. Then, 3 weeks later, the patient had a general improvement and the high doses of oral steroid was progressively reduced to the lowest dose and the azathioprine and mesalazine was continued. Finally, 9 weeks later, the extraintestinal and intestinal manifestation was controlled. In this case report, we exemplify the extraintestinal and intestinal manifestation of ulcerative colitis and the use of azathioprine to treat both manifestations and to reduce the toxicity effects